And she's pretty healthy, but she has some issues with her blood pressure, and she's got a hip that she needs to have physical therapy for. And it's these small things that are really important to people and that can keep whole families healthy. And we just heard, too, from a woman who's pregnant, who's about to be delivering, and it's a healthy pregnancy, but she needs to make sure that she can access her provider and have a safe delivery. So we're doing all that we can. Our whole community is really working hard to implore the legislature to make sure that these folks can have coverage for this year.
I mean, at this point, it's the worst thing to be thinking about. You know, when you're thinking having a pregnancy or someone who's an elderly, you know, there are other things you really don't want to be worried about your care being cut or having to worry about getting coverage and not being able to have access to a doctor. And so what do you say to people when they come to your office or they call in and say, you know, this is what's going to be happening? Like, what kind of words what do you say? Well,
we have a helpline, and we encourage anybody to call our helpline, and we can, the email or the website is, you saw it up on the screen before, and the phone number is 1-800-272-4232, and there's the website again, hcfama.org, and you can call us. We answer the phones 5 days a week in English, Spanish, and Portuguese, and we can help anybody who's concerned about losing coverage or who may be coming off and on again. People who've lost their job, we're getting a lot of calls right now from folks who have never been in the system before, and this is the very first time that they've needed to access any sort of assistance or public programs. So if you or your family member or a neighbor has received a letter that says that you may be losing Commonwealth care or you don't have coverage and you want it, just give us a call. We'll pick up and we'll talk you through what your options are, what you may be eligible for, and if it looks like you might be eligible for a program, we can sign you up.
Great. Yeah, I mean, I think the helpline and Healthcare Forward is here to help. And so anytime you need it, if something doesn't make sense or you get these crazy forms and you're like, where do I begin? And I think this is the perfect resource to kind of reach out to and say, walk me through it or tell me what I'm supposed to do. And so to remind people, at the end we'll give the number again so people can call in.
Great.
So in terms of CommCare, I'm not really sure who get covered under that and how it works.
Yeah, so Commonwealth Care is a new program. It's very special. We're the only state in the country that has it, and it is for folks who are making too much money or may not qualify for Medicaid but can't afford anything in the private market. And so it's for folks up to about 300% of the federal poverty level, which for a single person is about $35,000 per year. So that's what you would make per year.
I think that's like such a big, it's not a big number.
No, it's not. Trying to live in Boston, it is not. You know, other places in the country maybe, but certainly not Massachusetts. And so for a family of four, it's about $64,000 that you might be eligible. And it's a comprehensive quality program. There's 4 different managed care organizations that offer it, and so a lot of different provider networks, but it covers routine care, preventive care, hospital care, catastrophic coverage, and depending on your income level, there's sliding scale subsidies. So you may pay either $0 for a premium or as much as $116 per month. And then for everybody, there's some co-pays if you go and you have prescription drugs or you have visits.
So right now, I know we're down to the wire in terms of the decision.
Yes, we are.
Whether it's tomorrow, like less than 24 hours in terms of when there might be a vote or there may not be in terms of the budget. So for people, I know we talked about this a little bit earlier in terms of what do you do sort of as you wait if it doesn't go the way we want it to go, sort of what can they do now just in case?
Well, right now it's in the hands of the legislature, and in particular the House of Representatives and Speaker DeLeo. And I am asking everybody I know, family, friends. I live in Cambridge too, so all of my neighbors and residents here in Cambridge to call your representative, call your senator, call the Speaker of the House, call the Senate President, and let them know that you care about this. Let them know that this is an important issue to you. And there's a lot of reasons that this is important. It's individuals' health, but certainly it's families' health. We don't want parents losing health care because then their kids are more likely to get sick too. That's a huge issue. But also, if people don't have health care, then they don't seek care and they end up much sicker. So if you have diabetes and you don't get that treated, or you have an asthma attack and you don't have your inhaler, it's a lot more expensive and a lot more costly for you as an individual, but also for the state and for the system if you then end up in the emergency room.
And then in the long run, you know, this can get aggravated in terms of other issues are added onto that. So it could be diabetes, but then something else because he wasn't taken care of.
Right. And so this show today is so timely because there's a chance that this is going to come up tomorrow in the House.
But there's still time, so people
there's
can
still
call
time.
in. And
so it's after 5 o'clock today,
Yeah.
so 9 a.m. tomorrow you can
First
start
thing.
calling, unless you have a personal relationship with your representative.